Hi, I'm Dr. Rick Pumill from Cross County Cardiology, and welcome to Whiteboard Wednesdays. Today I thought we'd talk a little bit about heart murmurs and what they mean. So a heart murmur is a sound that we would hear through our stethoscope when we're listening to your heart. So we have four valves in the heart. We have the aortic valve, the mitral valve, the tricuspid valve, and the pulmonic valve. As we get older, aortic stenosis would be the most common valvular abnormality causing a murmur. Calcium deposits start to develop and it restricts the opening of the valve. Mitral murmurs, most often talked about as mitral valve prolapse. Upper chamber of the heart, lower chamber of the heart. Blood comes through. This is the mitral valve. Normally, the mitral valve should close on this side. Mitral valve prolapse means it's prolapsing backwards and that can cause a murmur and some leak. Most times, no treatment is necessary for that unless it's moderate to severe. And the same thing is the case here. We would just follow it periodically, make sure heart function doesn't change.